I wanted to be a physician's assistant when I first started here. So I started out in biology, and then I actually went on a brigade, the Global Medical Dental Brigades. My first year I did that, I kind of realized that maybe the medicine aspect really wasn't for me. I like to work with people. I really like those interactions. So I just kind of made that shift to health administration because I knew I wanted to do something in healthcare, in like public health, that kind of range. So that's kind of what changed it for me. It's really important to listen to the needs of others and figure out like, okay, how can I approach this based on what this person is saying that they need, what is best for them. If you're not listening and you're not taking in all the signs that you need to really better a person's health, it's like a fruitless effort. So I think that's really important. And when I think of public health, I just think of how it's important to be a great listener, an active listener. I was also one of those people that had no idea what I wanted to do, and I think in total I changed my major 5 times in my undergrad experience. So there are gonna be experiences that you have that, kind of challenge you, question what you thought you knew. But I would just say like embrace those experiences, because a lot of the times they're telling you something that you're just not ready to hear yet. And so that's also another reason to join public health. There's so many different avenues that you can go down. It's going to be okay. Like you're gonna find out what you want to do, and it's gonna come naturally once you find it. You just have to be open to those experiences that help you find it. That's what I would say.